Recently, the U.S. Bureau of Labor Statistics dropped some game-changing news for the future of physical therapy. According to their latest projections, we're looking at a whopping 15% growth in physical therapist employment opportunities from 2022 to 2032. That's way faster than the average growth rate for most other occupations. This increasing demand for physical therapists comes from the need to replace workers exiting the practice, combined with other factors including age-related physical therapy for baby boomers, better quality of life for patients while reducing ER visits and readmission rates, physical therapy in younger patients due to sports injuries. But here's the thing. The growth of this industry stretches beyond just needing more physical therapists. In fact, the need for skilled medical billers and coders is also expected to rise. Let's face it, in the world of healthcare, getting paid on time is crucial to keeping the lights on. So making sure your medical billing and coding team is on top of their game should be one of your practice's top priorities. We can't have a video about medical billing without mentioning our favorite current procedural terminology codes, or CPT codes. These codes are the lifeline of your revenue cycle, describing the services provided during a healthcare visit and ensuring that physicians get reimbursed for their hard work. Without proper billing and coding, well, let's just say revenue slips through the cracks. This doesn't just apply to physical therapy practices either. A lack of accurate billing and coding processes in any healthcare field can negatively affect a company's financial viability. But we are here to talk about physical therapy medical billing specifically, so let's get back to that. One of the trickiest physical therapy CPT codes that billers deal with are dry needling codes. Let's take a look at the importance of CPT codes in general, what dry needling is, what the codes entail, and more. These dry needling codes are a part of the Level 1 CPT codes. For Level 1 CPT codes, there are a few requirements and criteria that services or procedures must meet. Physicians and qualified healthcare professionals all over the United States must regularly perform the services or procedure. The service or procedure must align with current healthcare practices, and there should be solid proof that it meets clinical efficacy requirements. You can find all these requirements neatly packed in the CPT code change application. Since January 21st of 2020, Medicare covers all types of acupuncture. This includes dry needling for chronic low back pain, so long as it's within specific guidelines in accordance with NCD 30.3.3. So what exactly is dry needling? For those of you scratching your heads, dry needling is pretty much what it sounds like. It's trigger point dry needling, or TPDN, a technique specialists and physical therapists use to tackle pain and movement issues by inserting thin needles through a patient's skin to treat myofascial trigger points. Trigger points are tender portions of a muscle which are highly sensitive to touch. Inserting these needles helps to alleviate the pain in that trigger point area without containing medication. Thus, professionals refer to it as dry needling. Dry needling is helpful for decreasing tightness and increasing blood flow in the body and can treat a myriad of conditions. Some conditions include the following: tendinitis and migraines, spinal issues and whiplash, carpal tunnel syndrome, joint issues, and disc issues. The complications associated with this CPT category don't have to do with the amount of codes you need to learn, unlike other CPT categories which can have hundreds of codes. The Centers for Medicare and Medicaid Services, or CMS, approved only two CPT codes for dry needling, 20560 and 20561, so thankfully these are easy to remember. CPT code 2560 covers needle insertion without injection in one or two muscles, whereas CPT code 20561 covers needle insertion without injection but focuses on 3 or more muscles. The complication and confusion comes from what services these codes will cover and what they won't. The codes only cover chronic low back pain, like I mentioned earlier, but what are the requirements for this diagnosis, you might ask? They include pain or issues that last 12 weeks or longer, no identifiable systemic cause for the pain or issues. Systemic causes might include metastatic, inflammatory, infection, or other disease. Issues or pain not associated with surgery, and issues or pain not associated with pregnancy. Here are a few helpful specifics to keep in mind with dry needling codes and coverage. Medicare covers up to 12 visits in 90 days. They also may cover another 8 sessions after the initial 12 if the patient sees improvement. Professionals may not administer more than 20 acupuncture treatments annually, and if there is no improvement, it is possible for Medicare to terminate the treatment altogether. As for all other conditions, dry needling is not covered. As the population continues to age and industry technology and techniques continue to advance, we will see the need for physical therapy services continue to rise. Making sure to incorporate the correct CPT codes in your medical billing practice is crucial for maintaining financial viability. Staying informed and being able to adapt to industry changes keeps your practice ahead of the curve. If you'd like to learn more about physical therapy CPT codes, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.